Hi, Dr. Jane Hendricks, owner of Stem Cell for Life, and I wanted to speak on the questions a patient should ask when calling stem cell clinics. So I think most patients by now know, hey, let's find out how many stem cells we're going to get. That's an important question to ask. And the unit of measurement should be like number of stem cells, number of colony forming units, not number of milliliters of fluid. That is not so common as it used to be when I first started because amnio and placenta fluid was being used, and that's not commonly used anymore. So I think most patients are getting quoted a number of stem cells, so that's good. But just make sure that if you are quoted in milliliters of fluid, that you're aware that that's either a mixed product, so that they don't know the exact number of stem cells, or it could be an amnioplacenta, and that has a negligible amount of mesenchymal stem cells. It has some cytokines and growth factors, so it's fine for some minor joint injury. But for systemic IV, or if you really want to get some work done with your joints, you really do need just the stem cells. And so quoted in number of stem cells is the unit of measurement, or colony forming units. The next question you should ask, and now this is still getting overlooked quite a bit, I've been harping on it for a very long time, is the viability. And if you are going through a clinic that's purchasing the stem cells from a USA-based manufacturer, the viability has to be documented. There has to be a certificate that comes with the package, and that viability is documented. Viability just means what percent of the stem cells in that vial, in that product, is alive or dead. So before the FDA got more strict with that, there were labs that were making products with very low viability. That means not a lot of live stem cells were present in the vial, so maybe you were getting a high number of stem cells, but no one knew the viability because it wasn't required by the FDA to test that. The supplier I've used the whole time has always documented that because they would serve the US military and parts of the government. So that regulation that passed in 2021 didn't change the processing of my supplier. It's always documented a viability, and they test it the night before you get the stem cells, and it usually comes in at 80 to 85%. And then the way I administer the stem cells, I'm very conscientious about protecting that high viability so that you are getting a very potent product. And just so you know, 80 to 85% viability is 10%, 5 to 10% above what the FDA requires, which is 75% viability. A clinic, if buying from a United States manufacturer, should be able to answer that question and show it to you on our certificate. A lot of clinics are buying the stem cells from abroad, so they may not have that documented because that's not required in Panama or Mexico or India, Pakistan, wherever they're getting it from. The viability is not documented most of the time. What you'll get if the clinic is buying it from overseas is expanded or cloned stem cells. That means they're harvested the stem cells from an umbilical cord some time ago. Like this one clinic in Mexico, they charged $30,000, expanded stem cells from an umbilical cord tissue that was obtained 8 years ago. So when I'm using non-expanded stem cells, the manufacturing date was just 2 weeks ago for the patients I did this week. So I hate to use the word fresh, but yeah, I mean, it's much more potent. You're going to get stronger stem cells when it comes to proliferation. That means their dividing capability, and their differentiation. That means how easily they can turn into different kinds of cells. So if you're getting it for irritable bowel disease, you want those stem cells to help facilitate healing in the intestines, and you want them to differentiate into that kind of tissue, or with the brain, nervous tissue. So just depending on what we treat. Cloned stem cells have already been divided out synthetically in a petri dish, so they're weaker. They're not going to have as strong as a proliferation or differentiation. This is evidenced in studies. So studies have been done on this. So there's no question that that is a reality of cloned stem cells, and we also know that the risk for contamination is higher. I'm on Reddit and I see all the people talking about the infections that they've gotten. So I don't think it's worth, if it's Actually, the cost from some of these medical tourism clinics in the South is actually double the price. I mean, it's double my price for cloned stem cells. So they're not even spending as much money as a clinic is when we're having to buy from an FDA registered lab. It's more costly. So cloned stem cells are cheaper for the clinic. They're charging a lot of money. Because you're also, some of that money that you're spending is not just going through, it's not going to high quality stem cells, it's going to cloned stem cells, but they are marketing a free trip. So flight and car and hotel. I just think that when you're trying to get well and you're working on a health condition, the finances, if it was my family member, I would say focus on the money that you're spending towards the strongest possible treatment and the best follow-up you can get. And that leads me to the third question, is what kind of follow-up are you going to receive? I mean, there's a clinic in Florida, $30,000, 3 months of follow-up. My treatment is nowhere close to that in cost, and I follow my patient for 6 months after an IV or even just a back injection, because that's how long it takes to realize the full outcome of any stem cell treatment is 6 months. So I'm going to be communicating with my patients the whole time for 6 months and complementing the stem cell treatment with diet and supplement recommendations. I treat medical conditions. I've treated medical conditions for 22 years. I'm not an IV clinic. So we have frequency treatments. I do lots of other treatments like hormones and peptides. So it's not where you come in and you get an IV and back on the airplane you go. So all kinds of autoimmune conditions and cancer and inflammatory conditions are being treated in my clinic. So the stem cell modality was added, almost 10 years ago to my list of the modalities that I'm still using right now. So it's a comprehensive full service clinic. If you have any questions, feel free to fill out the online appointment request on my website, stemcellforlife.com, and it's below in the description. And you can also call to schedule a complimentary consultation if you're ready and looking to schedule a treatment. Please call to schedule a complimentary consultation to go over your individualized treatment plan. Thank you.